So hello friends, welcome to my new video. So today in this video I'm going to discuss with you all about a very important topic that we all should know and we all should follow, that is importance of history taking. So from this video you will get an idea that what are those things that you need to keep in mind while taking history. Okay, so let's start. So first of all, what is history taking? So history taking is basically the documentation of patient sufferings. Okay, that what is the patient suffering and how the patient underwent anything specific that leads to the patient to these sufferings, so that the patient came to your clinic. So every day we deal with many patients with having many symptoms, and they say that I am having photophobia, burning sensation, pricking sensation, redness, watering, anything. So all these things documentation properly and related to its systemic things, or using some medication or having an injury. So for proper documentation of those things are called history taking. Okay, so history taking of the patient is very important. It helps us to understand what problem the person is actually having, and history taking, proper history taking will give you 50% of the diagnosis of the patient. Okay, so that's why you need to focus the patient history first. So by seeing the clinical picture or clinically with the help of slit lamp, we can understand, yes, the patient can having this foreign body on his cornea, or papillae formation on his upper tarsal conjunctiva. That is another thing, but I am talking about only history taking. That from history taking we will get a basic idea about the patient suffering. Okay, so what are things that you need to keep in mind? So here I put pictures of some children are playing in a swimming pool, or said this is dust. So history taking, the patient came to you with suffering. So this suffering can be due to some incident that the patient went for a bath in a swimming pool, or the patient went to a dusty weather where some dust particle went to his eye, so it lead to some symptoms that happen to the patient. So you need to think like this, that yes, it can happen, and you need to ask accordingly like this. Okay, so suppose the patient is saying that since 4 days, or since 5 days, or since 1 month I am having problem of pricking sensation, or I am having problem of redness with ocular pain in my right eye. Okay, so you need to ask that whether the patient underwent any ocular injury in the past or not, or he is using some medication or not. Like this, you need to correlate the patient symptoms or complaint with your thoughts, then only you will get a proper idea actually. Okay, so the first thing the patient will say that I am having photophobia, burning sensation, redness, that will be the chief complaint. Okay, so that will be, you will write a chief complaint section, and always remember to note the duration of the patient symptoms. That means how much long, or what is the duration of patient symptoms, that how many days the patient is suffering from this symptom or that symptom. That is also very important thing that we need to keep in mind. Okay, and then we can ask the patient that do you have any history of ocular injury or head injury that leads to this condition or not. So sometime, because when I see the patient in OPD, then many patients complain that yes, I had an ocular injury 5 years ago on my right eye, and there was some blood accumulation on my eye also, but I underwent medical treatment and it is resolved now. But the incident happened on the patient eye can be recurrent, or it can lead to some infection, bacterial infection or viral infection, because when the patient exposed to this or when the patient has an episode of ocular injury, then some part of the eye is exposed, so it can lead to some infection. Okay, so this infection can be recurrent, that at particular at some amount of time these symptoms are now reduced, and after some time this microorganism again growth. So it can also be happen, or the many person having allergy to many eye drops. Okay, so you need to ask the patient that do you have any history of allergy to any eye drop or medication, or do you are using any eye drop right now, like this. So if the patient that yes, I am using this drop or that drop, and after putting that drop on my eye, I feel very much uneasy like this. So this will give you some key points about the patient actually suffering, what is the thing. Okay, another thing is that see the patient facial expressions also, that how the patient is telling you. If the patient is suffering from that thing very much, then you will see facial expression like patient is very sad and saying you that yes, I am having this thing, that thing, and he is again and again touching his eyes or rubbing his eyes like this. So by looking at the patient facial expression and body language, you will also get an idea that how much severe the problem is actually, because there is many patient who actually do malingering. So this is also a very unique thing that we can look at to an actual patient having symptoms and to a fake patient who is pretending to be ill but he is not actually ill. Okay, so these are the things that you need to keep in mind, that is seeing the body language, seeing the facial expression, and always make the eye contact with the patient while you are taking the history. Okay, another thing is that take the note to a specific incident, that the patient went to a dusty weather and after that he is feeling this type of things or problems, or the patient is a farmer and he work in a sugarcane field, so he had an episode of injury to sugarcane leaves. So maximum it is seen that those people or those person who had an episode of sugarcane leaf injury, they are actually having fungal infection to their eye. So you need to correlate that it is not a gold standard thing that sugarcane leaf injury will lead to fungal, but maximum patient that I saw in the OPD also, maximum patient are having fungal infection when they have episode of sugarcane leaf injury. Okay, so another thing is that many people love to take bath in river. Okay, so they um, do regular bath in river. So from river also bacteria can do infection to the eye, because in some part of the river the water is little bit dirty. Okay, so this dirty water or in river water, it is not total purified. Many microorganisms are actually living in this river water. So if the person is washing his eyes with this river water, then it also can lead to some bacterial infection. So you need to ask the patient that whether the symptoms is acute or chronic. That means it appears suddenly or slowly, like patient is complaining that blurring of vision in both eye. So you need to ask whether this problem is actually came suddenly, sudden blurring, or gradual blurring, that is slowly the blurring has came to his eye. So when the patient said that yes, there is sudden blurring, then it will give you an idea that yes, the person can have any retinal issues, or if the person have any injury or like this, so at that time sudden blurring will happen. But if the person or if the patient say that yes, there is gradual dimness, धीरे धीरे रोशनी कम हुआ है, तो तब हमें पूछना है कि what are that thing that lead to this condition actually. Okay, so if the and then the patient is saying that yes, I worked in a sugarcane field and then I had an episode of injury, and after that day now I am having this condition and blurring of vision, it started gradually and I am now seeing blurring of vision for distant and near both. So it is a very key point that yes, it can be an infection of microbial infection, and then you need to do the corneal scraping and send the specimen to microbiology lab for the proper documentation and proper identification of the microorganism that is responsible for this condition actually. Okay. Another thing is that association with systemic causes, because ocular eye is also a part of body. So if there is any systemic infection is going on, then the effect of this systemic infection will be seen on the eye. Okay, so you need to correlate, like the person is having diabetes for more than 20 years, and due to that diabetes there is many ocular condition can be happen. It can lead to cataract formation, it can lead to retinal changes also. So because if the person is having cataract, then the person will say that now since 4 months or 5 months I am having blurring of vision, but before that 4 months everything was looking very clear to me, but slowly my vision drops. So it is it can be a case of cataract formation, So you need to take the history properly about the systemic illness, that he is having diabetes or not, or because cataract is mostly age related thing, but due to any traumatic also cataract happen, but cataract will lead to slowly progress of this opacification that lead to slowly reduction of visual acuity. So you need to keep in mind this thing. And another thing is that thyroid gland disorder, like the patient is having hyperthyroidism. Many patients are having thyroid disorders and they are under medication of thyroid treatment also. So you need to keep in mind this thing, because we all know that hyperthyroidism can lead to Graves' disease, that is called as proptosis. So due to that proptosis, eyes will not be able to close properly, so it can further lead to exposure to some amount of eye, that can lead to exposure keratopathy, band shaped keratopathy, like this type of conditions. Okay, so you need to take the systemic illness also. Okay. Another thing is the hypertension. It is a very big issue that the patient is having hypertension. So due to this hypertension, mainly retinal changes coming. So if the person having any retinal changes, like the many patient has seen that, I have seen that patient having diabetes as well as hypertension for more than 10 years. So they have a very severe loss of vision. Why? Because diabetes or lead to diabetic retinopathy, and hypertension lead to hypertensive retinopathy. And if diabetic retinopathy and hypertensive retinopathy together appear on the patient eye, then the vision loss will be very much fast. Okay, and that is very hard to be recover. Okay, so the residual amount of vision that left in the eye, the consultant will try to save that vision, but the consultant also say that yes, we cannot return your full amount of vision, because due to this diabetes and hypertension you have lost maximum amount of vision, like this. So these are the systemic things that can associate with the ocular changes and visual changes. Okay, another thing is that is he addicted to something? Okay, is he addicted to something? Like many people are addicted to alcohol or smoking. So this alcohol or smoking, due to excess amount of consumption of alcohol or smoking, can lead to age related macular degeneration. That is also very much sight threatening disorder. So we also need to take history of this addiction also, and you will write it in personal history. Okay. So another thing I want to say that there is many patients who complain that blurring of vision in both eye, and they are not having any systemic history of diabetes or hypertension. So it can be due to third nerve palsy. It can be due to a tumor formation in the brain, that is suppose the tumor has formed on the visual pathway area. So it is ultimately blocking the two eyes visual stimulus to reach the occipital cortex. So it also can lead to reduction of the vision. So you need to take a look, and you need to focus those things properly to identify, yes, the person is having this condition or that condition. Okay. So in case of many what to say conjunctivitis cases, that is the most common cases that we see in the OPD. So in case of allergic conjunctivitis, the patient will say that he is having history of eye rubbing, eye itching, redness, and excess tearing. So these are the symptoms of allergic conjunctivitis. So from that history, you will get an idea properly that what can happen to the patient. If the patient is having bacterial conjunctivitis, then he will say that yes, there is some discharge formation, matting eyelids, and eyelids stuck together in the morning. So this type of history the patient will give you. Okay, and you will also see some discharge in the patient eye. So it will be clear to you that yes, the person is having bacterial conjunctivitis. Okay, so if this bacterial conjunctivitis lead to a prolonged period of time, it can lead to bacterial ulcer also, because Neisseria gonorrhoeae, which is responsible for conjunctivitis, can also lead to infection on the cornea, also lead to the corneal ulcer. Okay, so that is also very much sight threatening thing. Okay, so you need to correlate this thing. Okay, and like in swimming pool, there is also many people have a tendency to pee on the swimming pool, so it become not hygienic, non-hygienic thing. And if the person or if the baby bath in the swimming pool, then they have more exposed to those microorganisms like bacteria more than others, so they have more chance to get affected by those type of microorganisms. So you also take care of note down those things properly to rule out any type of thing. So you should not miss anything in the history. Okay, so each and every detail of the patient should be taken and note down. Okay, so that it will help you in proper diagnosis. Okay, so till now that's all. Thank you so much. Thank you so much for listening to me. Okay.